Hey, what's up everybody? This is Dr. Andrew Kim, MD. I'm a board-certified psychiatrist, and one of the most common questions that I get is, Dr. Kim, are these normal mood swings or is this bipolar disorder? Now, one of the biggest misunderstandings on the internet is that by simply having mood swings, that somehow this automatically equals having bipolar disorder, which is far from the truth. So if you stick with me through this video, I will explain in very easy to understand language what the common symptoms of bipolar disorder are. So first of all, bipolar disorder is a lifelong mood disorder. We don't know the exact causes of it. We don't have a cure, unfortunately, but we do have effective treatments. Now, when someone is suffering from bipolar disorder and things are not controlled, you can experience one of three different acute mood episodes. The first type is called a manic episode. On the other end of the spectrum, you can experience a depressive episode or a combination of both at the same time called a mixed episode. So first of all, what is a manic episode? A manic episode is when someone is experiencing an abnormally and persistently elevated mood, so super happy, super high, beyond normal, or a very, very irritable mood. And, keyword and, in addition to these mood changes, you also have to be experiencing an abnormally high level of energy. I'm talking about amped up, jacked up energy, almost like you're over caffeinated or you took a bunch of uppers, okay? So you need to have both of those for at least 1 week straight, a minimum of 1 week. And you also need at least 3 of the following symptoms. If your mood is only irritable and not super elevated, you will then need at least 4 of the following symptoms. So let's go through the list of other symptoms. First one is a decreased need for sleep. So I didn't say insomnia. Insomnia is I'm tired but I can't fall asleep. This is different. This is a decreased need for sleep. I have so much energy, doctor. Why should I sleep? Sleep? Why are you talking to me about sleep? I feel great. I don't need to sleep. I don't need to sleep. Okay, that's the difference. Now, the next symptom is pressured speech. So what we mean by that is your rate of speech becomes much faster than usual and you are way more talkative than usual. The other person finds it hard to even butt in or talk with you back and forth. You might be saying, hey, look, today's an awesome day. I had a great breakfast. I went for a walk. What are you wearing? What brand is that? You look beautiful. Oh my gosh, that looks great. I need to go shopping with you next time. And the other person has a hard time even getting a word in. That's what we mean by pressured speech. Kind of going along with that, inside somebody's thought processes, you can have racing thoughts or flight of ideas. This basically means that your thought processes are just going so fast and jumping from one thought to another, you almost feel like you're having a hard time keeping up with your own thoughts. All right? And this leads into the next symptom of distractibility. You can also experience a very high, artificially inflated sense of your self-esteem, and it can get to the point where you feel very grandiose. You might be thinking and saying things like, I don't know anything about the field of medicine, but I did some research tonight and I'm going to cure cancer tomorrow. Okay? You can also experience an increased in terms of your behaviors, increased goal-directed activities or psychomotor agitation. So that high energy has to come out somehow. So sometimes it comes out as productive activities, like getting more work done at the job, getting projects done, becoming more social, seeing everybody, talking with everybody. Or sometimes it comes out as non-productive energy, like you end up just pacing around, you're bouncing off the walls. You're starting one activity, not finishing it, moving off to another. Now, another symptom can be categorized as increased impulsive or risk-taking behaviors. And again, we all have different levels of risk, but this is way beyond your usual level of impulsivity and risk-taking. Things like increased drug use all of a sudden, increased promiscuity, just becoming promiscuous all of a sudden, going on spending sprees when you can't even afford it necessarily. So now, if you meet all of these symptoms, or again, the handful of required symptoms you need, it's happening for at least 1 week at a time. and it is causing impairment in your life, and it can't be explained away as a side effect of a medication, or it's not caused by drugs like cocaine or crystal meth, then you meet the criteria for having had a manic episode. And in order to be confidently diagnosed with bipolar disorder type 1, you have to have at least one manic episode in your lifetime. Now, let's say these symptoms don't last a full week and they last for at least 4 days. We call that a hypomanic episode, so a slightly less severe version of a manic episode. And if you get diagnosed with a hypomanic episode, then you meet the criteria pretty confidently of having bipolar disorder type 2. So I hope you got a better understanding of what a manic episode is. Now, let's move to the other end of the spectrum of the bipolar spectrum. So on one end we have a manic episode, and the other we have a depressive episode. Now, I'm not going to go into full details about all of the symptoms of depression, because if I took a snapshot of someone during a bipolar depressive episode, it looks eerily similar and almost identical to regular depression, or what we call major depressive disorder. Now, I've already made a very detailed video on the common symptoms of major depression, so take a look, watch there. I will go into a lot of details. For today, we will just do a brief summary and just remind you of what those symptoms are. So in order to meet the criteria for a depressive episode in bipolar disorder, you need to have at least 5 of the following symptoms for at least 2 weeks straight, okay? One of those symptoms has to either be a persistent depressed mood, so you're depressed nearly every day for most of each day for at least 2 weeks, or you have to have a decreased interest or enjoyment in your usual activities. So one of the 5 symptoms have to be at least one of those. In addition to that, as we look here on the screen, you also have to experience the following: significant weight loss or weight gain, insomnia or hypersomnia, which is sleeping too much, psychomotor agitation, which is basically like restless energy, pacing around, or the opposite, psychomotor slowing. You are slow to move, slow to get started with things, slow to talk and answer questions. The next symptom is fatigue or loss of energy, feelings of worthlessness or excessive guilt, concentration issues, and recurrent thoughts of death or suicide. So look, if I took a snapshot of someone during a depressive episode of bipolar disorder, like I said, it looks nearly identical to someone with non-bipolar depression. So this is why it can be so challenging to diagnose bipolar disorder, because unless you have had a manic or hypomanic episode, it's not so easy to diagnose. Because what if you haven't had one of those yet? Now, moving on to the final mood episode type, it is called a mixed episode. I will keep this simple. The symptoms of a manic episode and the symptoms of a depressive episode can actually be combined and happen all together at the same time. I know it sounds strange, but imagine you can actually have high levels of energy, not be sleeping for days at a time, be talking fast, your mind is racing, yet you're also depressed, crying, hopeless, suicidal. And it's all happening all at once, and it can get pretty intense and very distressing for that individual. Okay? I think most people don't realize it's actually quite more common for people to present to hospitals and emergency rooms with mixed episodes versus pure manic episodes that we're probably more familiar with. Okay? So look, in summary, the 3 different acute mood phases are a manic episode, depressive episode, or a mixed episode. Okay? Now, bipolar disorder is a lifelong illness. The challenging part is we don't have an easy way to diagnose this. I wish we had a blood test, a brain scan, some way to analyze your brain waves and say you have bipolar disorder. We unfortunately don't, okay? The way that we do this right now is we take a good, careful clinical interview and history, and we use the evidence and we use our judgment to make the diagnosis. Now look, sometimes a psychiatrist, a nurse practitioner, a therapist might witness you while you're in the middle of a manic or hypomanic episode, and yeah, then it's pretty simple to make the diagnosis. But oftentimes, we're not able to catch you in one of those episodes because most patients with bipolar disorder are oftentimes struggling with depression way more than they are with the manic episodes. Now you're going to say, stop, Dr. Kim. I know on YouTube, online, on at one of my local clinics, they say they have tests. They have a brain scan, they have a way to look at my brain waves, they have a blood test to say I have bipolar disorder. I want to stop you right there, okay? They may have these tests, okay, but they are not FDA approved and they are not considered standard of care. I'm not saying they don't have merit. There's a lot of promise to some of these things. They are somewhat research-based, but many of these clinics, not all, but many of them aren't just using it as a tool to help guide their diagnosis. Many of them are using them as cash cows. They are charging people in the community thousands and thousands and thousands of dollars for these diagnostic packages to just charge you a ton of money, to make you feel like somehow this is so much more advanced and high tech, when again, the standard of care is clinical interviews. If these were definitive, if these were standard of care, hospitals all around the world would be using them to get faster diagnoses, reduce needless suffering, and in all honesty, make money as well. But they're not, because it is not considered standard of care. I just want to advocate for you and make you aware of this. Okay. So this is Dr. Andrew Kim. I hope that you have a better understanding about the symptoms of bipolar disorder and understand that it's not as simple as just having a mood swing. If you like this video, please like, please share, please subscribe. Let me know what else and what other kinds of videos you'd like to see. But until next time, I hope you guys are happy. I hope you guys are doing well. I hope you guys are being safe. Dr. Andrew Kim, signing off.